what we're going to try and do is work our way through this presentation. My name's Paul Desmond. I've run the Hepatitis B Foundation UK for 5 years. I've taken about 8,000 calls from people who are diagnosed with Hep B recently. It's my job as a sort of a World Health Organization messenger to the House of Commons to get them to admit boom in prevalence, child infections, hospital outbreaks, school outbreaks, issues that aren't really flagged up enough in the press. What we're working on, especially an update from the Joint Vaccination Committee on immunisation and things, they are looking at streaming the 6-in-1 child immunisation quite soon. It could be rolling next year. What we're concerned about is that they're not really mentioning the 35,000 children who caught Hep B while they're rolling it out. So it's about quality of rollout. Because it's a 6-in-1 vaccine, the chances are it will get the sort of uptake that we all hope it will. But my concern is for the thousands of children who've already come here and already in the system. If I can move on, I'm going to try. Here we go. Just to understand hepatitis B, and one of my key jobs here is to get across to both the politicians, policymakers, and perhaps you, that within the United Kingdom, we haven't really understood it's a child pandemic. That in the UK, you're looking at 81% of people presenting to liver units having it mainly from child-acquired life overseas. Now, child infections happen mainly from family members to family members, from healthcare to child, or from schools or schooling. Now, over the years, we worked very closely with the World Health Organization and the Zuckerman family at the Hep B Foundation, and what we've noticed is every other country on earth understands hepatitis B moves very frequently through children from China, Pacific Rim, Sub-Saharan Africa. Up to half these children catch Hep B before they finish being children in those countries and places. So that's the scale of child onward transmission that we want to talk about today a little bit. Moving on, we've worked through this sort of cast, and we've had tests which are done in the UK called sentinel surveillance tests. These are done to keep an eye on how much hepatitis B or C is in our country. And what we're looking at, sorry about this, as I've worked through these individuals, David Amis asked 14 questions in the House of Commons about what's going wrong. On the left side are kind of hepatitis heroes, on the right side are hepatitis villains. I could talk a lot about each of them, but we don't have really time. Anyway, in the meantime, what we've got here, David Amis is the head of the Commons Hepatology Group. This gentleman asked 14 questions about very simple things like basic prevalencing from the World Health and the Hep B Foundation is looking at up to 500,000 Hep B carrier infected people in the UK now. This is working from the World Health Organization stipulation that 3 to 3.5% of all migrants have Hep B. Interestingly, I've noticed in the NHS, they often talk about we're prevalencing for 3 to 4 million migrants. But whenever I go to the Greater London Assembly, they say, well, we've got 4 million migrants in London. So there's an awful lot of insanity around figures from our government. And we have to be quite frank that a very simple survey of our country reveals millions and millions and millions and millions of people who come from endemic areas for Hep B. Half of London is such a person, and many other cities. Now, what we're finding, of course, is 81% of people presenting to liver units in the Cushy B study, child-acquired hepatitis B from overseas. More importantly, we notice 40,000 or so children flagging up with Hep B. And these children are on many different vectors of analysis. If I can talk about this, the first place we find them is, of course, the own sentinel surveillance testing. These are the figures. Now, what's a bit shocking is these figures are so much worse than what the NHS is telling us. We're still hearing 0.3% of England has Hep B in all the literature. And yet, look at what the hospitals are revealing when we test in the hospitals. Now, these figures are perhaps inflated by as much as 100%. They come with 50% error margins, if you know what I mean. But they're the figures. So a 0.89% national prevalence is what we've got now. Hi, it's 2014. It's obvious. Beyond that, unfortunately, 0.7% is the worst score for children infections in the developed world. To put it in perspective, it's 30 times worse than the States. So a catastrophe has occurred. We've failed miserably. And unfortunately, this is one area of healthcare we're not good at, is admitting our health mistakes. So we're rolling this vaccination without admitting a pandemic's the reason. Now, when we asked the Minister for Public Health all these questions about hepatitis, this is a taste of the sort of insane answering coming out of the House of Commons. Our Minister for Public Health said she couldn't recognise those figures we just showed you. Her own Health Protection Agency figures of 0.7% of children having hepatitis, 1.6% of adults having hepatitis in every hospital in England. David Ames asked them, and this is their response. We can't possibly remember what we just wrote online on our website. It gets worse. They also say that we only have approximately 4,000 children in the UK with Hep B. Now this is actually medically completely impossible to have 500,000 adults and 4,000 children. Every country in the world, 199 of them, tested their children. 10 to 20% of your pandemic is your children. They're the ones that do the catching. It's physically impossible to have 4 million carriers on Earth if half of them didn't catch it as children. If they were adults, they would have cleared. Moving on, it gets worse. If we move onward again to this attempt to close off the letter, again, poorly advised. When we mentioned 1 in 30 UK British have now signs of having caught Hep B, think of how common that is. 1 in 30 of us have got antibodies. She was under the impression only 700 people a year catch Hep B. I'm saying that, hey, 2-3 million people have got something. She's going, isn't it 700 million a year? You know, the acute way they count these figures. So it's very easy to get confused at the top. And that's what's happened. What's really frightening here is again, no understanding that Hep B affects 1 in 4 humans and is killing more people than World War II. You know, we've got 500,000 cases of Hep B on our plate. We've got about 10,000 TB sufferers. She hasn't understood that there's a reason why every border on Earth is testing for Hep B when people come over it. Moving on, down at the bottom, we are, at this time, still campaigning for universal vaccination. And again, she's completely unaware that children are catching it. Moving on. If we look at this as infections in the US, in 1990s, alongside the World Health Organization, they bothered to check what happens to children before vaccination. They found that 1 in 30 of the American Chinese caught Hep B as children each year. I'll repeat that, 1 in 30 US Chinese children caught Hep B each year before vaccination. Now, that, when you start to study across the world, every time a child rings up the Hepatitis National Helpline, Hepatitis B National Helpline, we go to countries of origins and start to ask questions. First place is the World Health and the US and border monitoring. All these borders test people, so they're finding out what the prevalences are. Down here, the prevalence amongst Somali households. In the early noughties, there was an effort by the NHS to find out how bad it is for our children. They tested the Somali migrant community. They found that 8.7% of their children caught Hep B before 5. I'll repeat that, 8.7% of Somali children were catching Hep B before the age of 5. Now, one would have hoped that spotting such a catastrophic scenario, our nation would have leapt forward with universal vaccination and safety testing. But it was all hidden away and it's gone on for 10 years like that. Unfortunately. We move on again to another test well worth studying. This is amongst the UK Asian community, inclusive of Pakistanis, Bangladeshis, Indians, Sri Lankans, Nepalese. Now that group have a lower endemic prevalence, but we still found 10% or 9% of the children, 9% of all infections were children. Now we estimate 150,000 Asians have Hep B in the UK. We've got 14,000 child Asian infections to find, to care about, etc. Hasn't happened. The Government is saying there's 3,000 children only. And blatantly. Simple analysis is revealing it's like everywhere else on earth. There's lots. Now, when I said, every time we get a call, we check, so lots of calls about Turkish children sharing it amongst their families, picking it up on holiday. We've run their different hospitals and found out 7 to 11 is their critical era. Moving on, if we look at another organisation, you can see clearly here, this is India, 37% infections amongst family members, brothers giving it to sisters, dads, uncles. The last infection on the helpline was a child infected by his grandma who borrowed the razor, came from Pakistan, borrowed his razor. It's 15, it's just got Hep B. Very, very common, happens all the time. You notice over here, undiagnosed chronic hepatitis in the British Chinese. Here we are, poor old Professor Basadine. She finds 10% of our Chinese have Hep B. We have 2 million Chinese, Sub-Saharan Africans, Pacific Rim. Are they all 10%? She has not gone to the press, nobody knows. Those 2 million people haven't been told they're 1 in 10 infected. This is not medicine, it's kind of a confusion. We are not being told what we need to be told. We don't even know how to avoid the transmissions of this thing. Enough. Moving on. Here we go with Sub-Saharan African. It's prominent amongst Japanese children, but they also found that they were still catching it. Sub-Saharan, so sorry, this is Zambia. 14 to 17 years was the age range there. If I just go back to that. 14 to 17 years age range, you can see that 18% of the children in Zambia are caught Hep B in this study. 18% of them between the age. So again, horizontal transmission. And what we're stressing as we work through these, again, this is that 1980s World Health Guide as to why you need to protect your child. And you can see in many countries here, by 14, 30% of children in Uganda have caught Hep B, Morocco, etc., etc., etc. This is a global pandemic, and there's a desperate need for people to realise it's in the UK now. Chinese later, I can't work through all of them, but I do want to come back to this lady, and I do want to very much bring up that I will have to, and I'm talking in the YouTube, because I'll be sending this YouTube to you, Jane, and there'll be an overwhelming desire. I'll get Boris, and I'll get Professor Williams, and I'll also get Dr. Lee MP, and Charlotte Leslie MP, and Steve Pound MP, and David Ames MP, to ask you the question again. And moving on, we've got to talk just momentarily about this woman, Mary Ramsey. Hello Mary, we're going to be questioning you too. She's come up with the notion that only 3 children since 2001 have had a horizontal transmission. The US government would expect 200,000 in the States among its Chinese community alone over the same sort of period if they weren't vaccinated. She's noticed 3 of our 35,000 child infections. So very concerned about this woman. What she's done with a little diagnosis effort is also noticed that 1% of our children has already reached end-stage liver disease. So these 35,000 children may well present with 350 of them having liver cancer or cirrhosis. This is something that totally shocked me and inspired me to come and just talk about children today. This is a serious problem. There are more toxins in the food chain now, but it's news to me that a child can progress to that level of illness so quickly. But when you have hepatitis B, what's in the food chain can do that to you. Paracetamol, ibuprofen can do that to you. So what is happening to our children? And she mentions what I call 3 horizontal infections, and I just wanted to mention 6 that happened on the helpline after I read her medical study. This woman, Kai, rang. Her husband has Hep B. All of her 3 children caught it. She was told they were vaccinated. Gives you an idea how quickly horizontal things can move around a family. And the one below, the issue I'm still pushing with the NHS, is they were given insulin for dad who had Hep B. All 3 children caught it from needle stick accidents. England does not hand out Hep B vaccinations with home injections the way America and France does. There's a good case for thinking about doing that. And these are my strongest thoughts just from a more third sector charity background. Finally, just a couple of things to talk about. Premiership blood hygiene. This MP you might have seen in a swimsuit, she's Charlotte Leslie. She's also into boxing, which made her probably the most enjoyable person I met in the House of Commons. But what she does is she's aware that many of our children's contact sports are infecting them with Hep B. We've had outbreaks from a number of boxing clubs, etc. Fighting in the playground is a great way of getting it. This guy, Steve Pound, we had 4 tattoo shops reporting large outbreaks. And we went to the Commons. Steve has got Hep B from a tattoo also. Ealing North MP, so he's in charge of that stuff. There is no kite mark for piercing or tattooing in the UK. It is as dangerous as unprotected sex. And that's just for everyone watching YouTube. And I don't think that, the blood bank think that. They won't take your blood if you say you've had lots of sexual partners, or if you say you've had a piercing or a tattoo, because they are all guaranteed to infect certain amounts of people. Dr. Lee, and also talking to you, he's the brave soul that asked for border safety screening to catch our 3% of migrants before they progress to liver cancer. He actually received death threats for this. And you know, I want you not to be worried about those, Dr. Lee, and try harder. Good. Finally, if I can find them, I just wanted to let the children talk for themselves. These are recent front of mind calls that I can remember on the helpline. A 16-year-old asked to do cleaning, pool of blood. She had cuts on her fingers, she got Hep B. 17-year-old porter, eczema, bloody wheelchair, got Hep B. 16-year-old Malaysian, the mum knew she had Hep B but could never find the courage to tell anybody, and the daughter caught it at some point. 17-year-old, chronic from a tattoo, he turned up yellow in Morrison's. Yeah. We went to the tattoo parlour, the lady had a piercing here. Every time she touched his blood, she touched her piercing, touched his blood, touched the piercing. On to the next one, touching the piercing, touching the blood, all the time. I watched her for 2 hours. No problem seeing how she's infecting people. A 4-year-old sent back to Sierra Leone, unvaccinated, naturally came back infected. They have a real problem with clean needles in many third world areas and war zones. Hep B is still endemic in the health services. 18 did his first aid course, managed to get himself and his partner infected. That was the St John ambulance course. And could you turn the camera just briefly on that gentleman at the back there? Hands up, you. Yes. The gentleman standing there is the representative of he's the representative of the nursing profession from St John ambulance. I'd like a little round of applause for him because he's just survived liver cancer. Only 10% made it through the year, and there's no way I'm getting rid of Ian yet. But my point about that gentleman is we have 1 million first aiders, nominated first aiders in schools, in high street areas, all of them misadvised and not vaccinated for Hep B on the whole. Even, last point, looking at GPs, I had a GP call the helpline recently. She'd stopped because someone had fallen over and was bleeding. She staunched the blood flow and thought, but my vaccination's out of date. When she went back to her GP and said, look, I need the booster, she was told it's £65. And all I'm saying is that's how confused this is. We need to really be a lot more honest about the nature of this peril that our children face. These children, they go on and on and on. There's more and more and more of them. You know, I'll put this online. Anyone wants to read about all these kids, all these calls are so heart-rending. I wish every single one of the MPs I'm talking to could meet children who are dying of this and talk to children. Explain to them, you know, like, you've got this, and we're sorry. We're the only place you could have caught it on earth, but we forgot about you and this. And that's really a bit of a wrap. And what I'd like to do, just in closing, is to just say to this gathering, I'm going back to the House of Commons, and we really do have to ask, when is this country going to have the hepatitis atlases that go with the vaccine, so that travellers and mums can see which children need it right now today? Thanks very much. Any questions?
Thank you very much, Paul.